Minister, thank you very much for your time. Now, first of all, your reaction as government to how South Africans are being treated by the international world. All right, it seems we don't have clear connection to Minister Joe Phaahla. Let me just try again. Minister, please confirm if you can hear me. The question is your reaction as government to how South Africans are being treated by the international world.
Well, I'm not sure what side my voice is coming through.
It's coming through now, Minister.
There was a break. Just repeat the question because the network did break. Just repeat the question.
Minister, I'm sure you've heard, besides the fact that we were put on the red list by the world's biggest economy, the UK, in reaction to the announcement about the new variant, other countries have fallen suit, and now our international travel has been banned. Planes have to be sent there to ferry South Africans as if we were being rescued. Your reaction as the Health Minister to how we're being treated by the international world?
Well, I would say it's quite a misguided and unfortunate reaction, and one just wonders really what informs some of the world leaders who have taken this kind of steps, because this is not like March or February 2020. We are now in November 2021, and we've been through this path for more than 20 months now. We know what works and what doesn't work. We know that travel bans don't work. We know that, for instance, when the coronavirus, COVID-19 broke out in China, the US was amongst the first to stop traveling between US and China. The former President Donald Trump actually was really praising himself for having taken that step. But I think the consequences or the repercussions of that, you can to show that it just creates a false sense of security, because that's what it did in the US. People felt safe that there is no travel from China, but not understanding that the virus travels much more quicker, and by the time you do something, it just creates a false sense of safety when the virus is already within your midst. So it's unfortunate, and it's very, as far as we are concerned, it's a misguided, but we are engaging with those countries. We are talking to them to say we've got tried and tested methods which can sustain and have sustained even the reopening of traveling. At the current moment, there are protocols in terms of pre-travel testing. Some of the countries also include testing on arrival. So and screening and all those, make sure that we can protect each other. But we are engaging with many of this leadership of these countries to try and bring sense to them.
So it's a very busy weekend then for the South African government, Minister, especially with the NCCC having met yesterday. Can you tell us anything as the custodian, one of the lead people in those meetings? What can we expect? Should we expect the President to speak to us tonight?
Well, the meeting did take place yesterday. The robust discussions, presentations in terms of what is the situation, and a very active and robust discussion on scenarios, on what are the implications, and those meetings will be continuing together with consultations today, consulting various key role players in the country, various people in leadership. So there will be active engagements, and then somewhere in the afternoon, all this consultations will be brought together, and then leadership around him, the minister in the presidency, and others who who have received. We also receive, a brief from
I wonder if Minister is able to...
Okay. And then all that information only as health, we provide the basic information and proposals in terms of what is happening and what are the options. And then, up to then, it will be the president and cabinet to make a decision.
Minister, there's also the rumours of interprovincial travel because of the fact that Gauteng is showing such a huge number. People saying that it's that time of the year when people travel home to your Limpopo, KZN, etc., because most people in Gauteng are not from here, right? They're here for work. Is this true? Is the rumour true? Are we shutting down interprovincial travel?
Well, it's quite regrettable that somebody who was in the press briefing where I responded to questions just chose to misquote. I mean, it was quite interesting that I saw this tweet from somebody from another media who was saying that I said the interprovincial travel is likely to be restricted. But at the same, somebody who was in the same press briefing from another media emphasized that I've said clearly that there is no decision on any restriction at this stage. Now, the correct is the latter, that we have not made any decisions on any restrictions. These are matters which are not taken very lightly because we know the impact. So these are matters which, through all these committees which I've mentioned, consultations which I've mentioned, have to be processed. And if there's got to be any, it will be after very thorough consultation with various stakeholders. And at this stage, I can assure the nation that such decisions have not been made. And at this stage, we must just await the final process. And when the head of state and the people who work with him decide what format of communication with the nation, those will come out. But at the current moment, there is no such a decision.
Is that being considered, though, because of what I've told you in terms of it coinciding with December and travel and Gauteng showing, more than 70% of what the numbers that we're seeing?
Well, in a situation like this, when the virus, you've got mutations, you've got the virus spreading, as leaders, you have to consider all aspects of what are the modes of transmission. We know crowds, crowded situations, in terms of when people travel, congested in taxis, in trains, in buses, when there are big gatherings, especially indoors. We know this is not new science, but the question is knowing that this is how the virus spread. Now, what are the options? So I cannot say that leaders, responsible leaders, will not look at what are the possible interventions with as much as at the same time, we know our modus operandi, our policy is saying save lives and save livelihoods. So that balance between saving lives and livelihood is continuing to inform the leadership of the country in terms of options which are being considered, knowing this is how the virus spreads. So in terms of which way to lean and which way not to lean, it's all really going to depend on what are we seeing and what do we see as, the balance between the two, the saving lives and saving livelihoods at a particular time. So I'll be preempting, and I'm not in the position to preempt in terms of the direction which the leaning towards the discussion. But, we've been there before. And as I say, the science is very clear in terms of how the virus spreads when people move and when people congregate. So all those matters are being considered, but whether in issues of traveling, in what way, that really at this stage is very, very premature.
Especially because a lot of people would say, well, why are we complaining as South Africa being banned from traveling to other countries when there's a likelihood that we might be banned from traveling in our own? But moving from that, Minister, I'm fully vaccinated. I opted for the Pfizer vaccine. Am I, as protected in terms of how sick I'll get if I get this new variant? Am I okay?
Well, again, the science and the experience now of the last, we have started our vaccination middle of February this year. So we're not only talking about what the science says, what the laboratory and the research says, but we can also talk of our own experience as a country. We have seen that, having started with the health workers and then following with the educators, with the police and various others, and the over 60s, the experience and the science, not only in South Africa but elsewhere in the world, tells us that notwithstanding the mutations, the variants, whenever people are fully vaccinated, when they do get infected, overall there is a lot of protection against severe illness, the possibility of lying in hospital, the possibility of ending up in ICU get reduced, and the possibility of succumbing to the virus also get reduced. So it's a well-documented, it's an ongoing experience. Even now, as we're addressing the media on Friday evening, the head of intensive care in the Christiani Baragwanath, Professor Rudo Matiba, was still reporting that even though it's still early now with this variant, what they have seen is that mainly those who have been admitted or those who have tested positive are mainly the younger people who have been involved in gatherings, parties, and so on. But even there, the 65% of those who ended up in hospital are unvaccinated. So the numbers tell us that these vaccines do protect. We have never said, and the scientists have never said, they prevent us from getting the virus. We can still get the virus, what is called a breakthrough infection in medical science, but the experience and the numbers do tell us that even when those breakthrough infections do happen, the likelihood of severe illness is highly reduced, Minister, 90% reduced. So I can say to you that you are far safer, you are 90% safer than who's not vaccinated.
Well, I'm happy to hear that, Minister. Now, tell me something, Minister. In the meetings that you've been having since yesterday and the other consultations that you'll be going through today, are you considering those of us who actually did adhere to government's call to get vaccinated? Because I don't want to be locked down in December. I don't want to be on level 3 or 4 or 5 in December, because I adhered and I supported government when you said go get vaccinated. Are you considering those of us who feel this way?
Well, those are the matters which, various leaders of society have put forward to us to say we need a differentiated approach for those who have responded to the call for vaccination and those who, within their own right, personal right, have decided not to vaccinate. So we're looking at those proposals and of a differentiated approach, so that there could be certain services, for instance. So those matters are firmly on the table. We're looking at the practicality of that, and I'm quite certain that as we're also learning from the practice in other countries, one of the colleagues yesterday was just giving an example of their experience in the city of Paris, where they were attending a meeting, that when you go to facilities like restaurants, into the trains and buses, if you are not vaccinated, you are not allowed in some of those services. So that is a practice which is happening in various parts of the world currently, to make sure that while we accept that people have got their personal right to accept or to reject a vaccination, but also every right also comes with its limitation. There's a right to the individual, there's a right to society. So if we're saying that vaccination is not good for an individual, but it's also good for protection of the society, because when you are vaccinated, even if you get infected, you transmit less and less, you carry less and less virus in your body, and therefore your possibility of infecting others is highly reduced. So you are protecting not only yourself but others. So we're looking at those advices, and we are trying to work on practical modalities. I can assure you that while we can't guarantee that because you are vaccinated, if there are certain limitations of movement and whatever, it totally won't affect you. But we are really very sympathetic and want to look at practicalities of making sure that there must be some advantage in terms of access to particular services for those who are vaccinated.
Minister, while I still have you, I know that I've had you on for quite some time now, but it's quite obvious that government will not reach its herd immunity target. It's quite obvious that we will not reach that 67% by December. But it's also this month that we're heading to, and this season is the same season that is quite challenging for our hospitals in South Africa, right? In terms of accidents and trauma unit, emergency units being packed. Are we ready, especially now that we're actually entering this fourth wave? Are we going to see our hospitals in trouble?
Well, the possibility is there. The possibility is there, especially that we only, at the current moment, just over 41% of adult individuals who have received a vaccine, some of those not fully vaccinated, but at least having had a jab at 41%. I think in terms of fully vaccinated, we're just below that at about 36%. So it's still risky. If you still have just under 60% of adults who are not at all have had any vaccine, is still a very high risk. So the possibility that, unfortunately, our health facilities and, our hardworking health workers there is a risk of them being, highly overwhelmed again, this December again, as it happened last December and January. So that risk remains, but there's still a window of opportunity. We're still sitting at average, as of yesterday, 3,200 infections. Except for Gauteng, many provinces are still at a low rate. We again, even at this hour, as we get closer to the festive season, where there's going to be a lot of movement, a lot of festivities, it's not too late. We're still saying to South Africans that please go to your nearest vaccination point. It saves life. It also saves your family and your people around you. So it's never too late, but the risk, I can assure you, is still very high in terms of our hospitals being overwhelmed again.
All right, Minister, thank you so much for your time and indulging us here on eNCA. Minister of Health, Dr. Joe Phaahla.
Thank you very much.
Trying to tell us a little bit of information, of course, about what to expect after that NCCC meeting, which was urgently moved from today to yesterday. So we'll wait to see when exactly the President can address the nation.